Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. And folks, this is episode 249 of the Everything Medicare Podcast. We're 3 years into this show, just one episode after this one. So next week on Monday, episode 250 will drop. It's a milestone, so I just wanted to start the episode off and just say thank you so much to all of our loyal listeners that have listened to us over the years and have come back week after week to give us support and actually help us reach more people like you who might be listening to this that need help with their Medicare and need their Medicare questions answered, and they just can't find it anywhere else. Folks, today we're going to be talking about a couple of things that Medicare either doesn't cover or they might not cover it as well as you might originally have expected when you thought about Medicare, right? We all go through life when we start hearing about Medicare. A lot of people don't even realize that when you're working and you have FICA taxes that are being taken out of your paycheck, essentially, a lot of people really just think about Social Security. And a lot of people, I actually read a study the other day that says the average person does not learn that FICA taxes are being taken out of your paycheck for not only Social Security, but Medicare as well, by the time they're 35. That's the average age that people actually learn about this. Now, you might be listening to this and be like, well, I actually didn't find that out until I was like 45 or 50. Others of you might be listening to this and you might think, well, I knew that when I was 25. Everybody's going to be different. But point is, when you talk to most people when they're in their probably 20s and probably 30s as well, Medicare is the last thing they're thinking about. However, when somebody actually starts to, go through their 50s, when people approach their 60s, when they're a year or two away from Medicare, they start thinking quite a bit about Medicare because the propaganda starts to get very, very loud. The advertising, the TV commercials, Joe Namath, all of these different media outlets, whether it be mail, phone calls, robocalls, television commercials, social media advertisements, they're all getting much louder and they're getting much more clear because it's something that you actually have to take. It's something that you actually have to put time into and something you actually are going to have to figure out. Because if you don't, and you hear about how you might be left out in the cold and you might not be covered nearly as well as you need to be. This is all true. But people a lot of times are going to have this expectation of Medicare in their mind on what Medicare is actually going to cover, what it's not going to cover. They a lot of times are surprised that Medicare has a premium for Medicare Part B. If this is your first episode you've ever listened to of ours, Medicare Part A comes at no cost to you. That's what your FICA taxes are essentially paying for throughout your working life. So as long as you have 10 years of working credits or 40 quarters, whichever you prefer, it's the same thing, you're going to not pay a premium for Medicare Part A. Either you or your spouse can have these working credits. So you can actually draw off of your spouse's working credits if you might not have the working credits yourself. Maybe you stayed home, maybe you raised a family, whatever the case might be. However, Medicare Part B is going to have a monthly premium in 2021 at the time of recording this of $148.50 per month. But that's usually a surprise to people. And that's not one of our three things we're going to talk about on this episode here today, but it's a small prime example that Medicare is not always what you expect it to be. Now, once you actually understand what Medicare is, what it's going to cost you, what it does cover, most people come out the other side thinking and feeling that it's going to be an upgrade in coverage overall. Medicare has incredibly low premiums for most situations, especially if you take a Medicare Advantage plan that doesn't cost you any premium and all you pay for is Part B. Medicare is usually going to have very good medical coverage. That's whether you're on a Medicare Advantage plan or Medicare supplement, either or, is going to be an upgrade compared to most employer plans, not all, but a lot. Certainly Obamacare plans, if you're not getting a subsidy or anything like that. It's going to be very good coverage compared to what you're accustomed to. We know this. But sometimes people have this expectation of Medicare that it's going to be free. It's not going to cost them anything. It's going to maybe give them full coverage. Like they think about these things. This episode is going to kind of break down that wall ever so slightly and discuss maybe a couple of things that Medicare either doesn't cover at all or doesn't cover very well, so that way you can be prepared for it if either you or a family member is approaching that 65th birth month. So let's talk about number one. Number one is very obvious, so I'm going to get that one out of the way. The other two are going to be much less obvious, so make sure you stick around to the end of this episode to get the full information. But the first one is, obviously, and this one might be kind of redundant. We've talked about it a lot on this show over the years on this platform. But that's going to be dental, vision, or hearing coverage. Now, this is one thing I wanted to take the time and kind of explain the differences, because people are always thinking, well, what if my ear gets chopped off? Is that not going to be covered? Is it like anything that has to do with my ears or my eyes not going to be covered by Medicare? Like, what if I need cataract surgery? What if, I have a floater in my eye or something along those lines to where I really need to go see a doctor? Well, here's how Medicare differentiates and distinguishes the differences between the two. If it's for a medical problem, it will be covered by Medicare. It's not considered vision for cataract surgery. It's considered medical. What's considered vision in the eyes of Medicare is if you need a new pair of glasses, let's say, just because your old prescription might have expired or maybe might not be current any longer. That's considered vision. That's not considered as medically necessary in the eyes of Medicare. That's why Medicare Advantage plans push that benefit so hard, because Medicare does not cover that. That's why dental, vision, hearing insurance plans exist for people on Medicare, because Medicare just doesn't pay for it. Now, if somebody needs a cataract surgery, that's a medical problem. Medicare is going to cover that like they would any other medical procedure. Ears are exactly the same way. Hell, teeth are exactly the same way. Let's use an example with your ears. If you are losing your hearing and you need hearing aids, now that's debatable on if that's a medical problem, but in the eyes of Medicare, no. And for the sake of this conversation, we need to really only look at things from the eyes and the viewpoint of Medicare. So that's not looked at as a medical cost. That's looked at as a hearing cost. You need a Medicare Advantage plan or a separate insurance plan to cover those things. But if your ear is bleeding, that's a different story. That's a medical procedure. That's something you're going to need coverage for. Another example, let's talk about teeth like I mentioned a second ago. If you need a filling or a crown in your mouth, I had a root canal done last year, not a medical procedure. Right? Think this through. When you really start to kind of think about this and look at it from the eye point and the viewpoint of what Medicare is seeing things as, and the way they have things set up and their criteria for what's covered and what's not, you start to see it a little bit clearly. So that's not medically necessary in the eyes of Medicare, a crown, a bridge, a root canal. But let's say I'm driving home tonight from work and some jackass is texting and driving. He smashes right into me and my mouth gets all bloodied and my teeth get all knocked out. Well, that's a medical problem. I'm probably going to need oral surgery. That's covered by Medicare. That would be what's known as Medicare covered dental. You'll see that a lot in Medicare brochures and Medicare summary benefits and evidence of coverages and just overall benefit descriptions. So to kind of put that into perspective, Medicare doesn't cover dental, vision, and hearing, but if you have something medically wrong with your ears or your eyes or even your mouth, that does not mean that's not going to be covered. See the difference? Now, let's talk about the other two, because the other two I think are going to be a little bit more shocking and a little bit more interesting. So the second one is Medicare does not cover a physical. Yep, that's right. I've even done an entire episode about this, but I know it was a long time ago. It's probably well over 100 episodes ago, and I know a lot of our audience is probably new. And so I thought we could kind of throw that in there and kind of dissect this just a little bit, because it's an interesting thing to kind of break down. Medicare does not cover a physical. Now, however, when you first get onto Medicare, they will give you a physical in your first 12 months. They call that a welcome to Medicare physical. After that, they'll never pay for one again. Ever. This is a common thing when people get onto Medicare, especially when they take Medicare with a Medicare supplement. This is why I say no option and no way of going is going to be perfect. I have people that I encounter all the time that they get onto Medicare, they're accustomed to getting a physical year in and year out. They go get their physical, the doctor takes blood, does a urine test, they do their due diligence. Now the doctor's office knows this isn't going to be covered, they just don't say anything because they don't care, right? They're going to charge you and they're going to get their money from you either or the insurance company. To them it's indifferent, right? However, 3-4 months go by, they get a bill for $300, $400, $500. I even ran into a fella that went to a doctor's office that charged him $800 for a physical in the last couple of years. And he just was dumbfounded by it. And he thought maybe it was billed wrong, coded wrong. Nope, Medicare just doesn't cover it. Now, Medicare does cover something that's known as a wellness visit one time a year. Now, a wellness visit can be best described as a less detailed physical. They don't check blood. They don't check nearly as many things, but Medicare does cover that. You have to specify that you want a wellness visit when you go to the doctor when you have Medicare, because if you don't, it's not going to be covered. Now, if you have a Medicare Advantage plan, different situation. Medicare Advantage plans cover different arrays of things that Medicare does not cover, a physical being one of them. So this is important to know. Now, if you need blood work done and it's due to a pre-existing condition, let's say you have diabetes or some kind of medical problem, that's not even looked at as preventative care in the eyes of Medicare. It's looked at as they're treating a reoccurring issue. So kind of know the difference. See how they're looking at things. The third and final example that I'm going to give to you folks that might be a little interesting for you to know about is that Medicare does not cover the new shingle shot. That's right, you heard it here first. Medicare does not cover the shingle shot, the new one anyway. There was a prior shingle shot, probably before the new one came out, maybe 3 to 4 years ago. Nowadays, the shingle shot that is used is referred to as Shingrix, and Shingrix is not covered by Medicare Parts A and Medicare Part B. It is covered under Medicare Part D. It is one of the few vaccines that works this way. It's curious. It makes absolutely no sense. And it's absolutely terrible that Medicare does this to seniors and they classify it this way because it really makes 0.0 sense. The flu shot is covered under Medicare, listed as preventative care. There's tons of vaccines that are covered under Medicare, listed as preventative care, but not the shingle shot. So, because of this, the shingle shot ends up being covered under Medicare Part D. Now, if you don't have a Medicare Part D policy or Medicare Advantage plan that comes with Part D coverage included, you pay 100% of the shingle shot, Shingrix. Now, the way that it's covered if you have Part D is it's usually covered as a Tier 3 with almost every plan. What this means is most Part D drug plans, unless you have a very expensive one in most markets, are going to have, now there's exceptions to this isn't the case all around, but a lot of plans in a lot of places are going to have Part D prescription drug deductibles. In the Medicare world, they put the prescriptions in tiers. They do from Tier 1 to 5, 1 being the lowest, 5 being the highest. Tiers 1 and 2 are your generics, 3 and 4 are your brand names, Tier 5 are your specialty drugs like cancer prescriptions. So a lot of Part D plans are going to have a Part D prescription drug deductible for any prescriptions that are Tier 3 or higher. Well, for a lot of people that don't take a lot of prescriptions, they might only take generics, might only take Tiers 1 and 2. They've never met this deductible or had to deal with it before. Then all of a sudden they go to the doctor and they try to get their shingle shot. It's billed under their Part D and they have to meet this deductible and then pay a copay after that. A lot of times people end up paying $150, $200 to $250, maybe even $300 for their Shingrix shot. And this is an absolute terrible thing. We tell every single person in our office that gets on Medicare about this. People don't always remember. They don't take it very seriously. So we get calls every single week about this, I swear. And it's absolutely frustrating, but it's something that you need to know about. There's really nothing you can do about it. Just be aware of it. Prepare for it. Plan for it. Put money aside for little tiny things like that. There's not a whole lot of those on Medicare, but the ones that there are can be a little bit shocking and can creep up on you. Anyway, folks, thanks so much for watching this video and listening to our episode 249 of the 3 things that Medicare might not cover as well as you might have originally thought. If you enjoyed this episode, if you enjoy our show, please do me a favor. Let us know about it by leaving a review. If you're listening on the podcast version, leave us a 5-star review. Mention what you like about the show. Maybe a story about how maybe the show has helped you if it has. We love hearing about that. And thanks so much for watching, folks. Hope you have a fantastic week. We'll be back next Monday. Take care now, and happy Medicaring.